Hi, everyone. Welcome to Anatomy Lab Week 1. I'm Dr. Richards. I'm one of your lab instructors, and I'm going to be walking us through the first lab packet, starting with some anatomical basics, some positional terms, and some reference terminology. Now, as we introduce anatomy, as we start talking about the skeletal structures, we have to describe these terms in an objective way. So we derive this common objective language so that I can describe a structure to you without having to point to my body. And so there are certain terms that we use in order to be objective in our description of these structures. Also, this is important in medicine in general. Physicians need to be able to describe certain parts of the body, again, without having to point to themselves, but in an objective way. One medical professional can understand another because of the use of this type of language. Okay, so let's describe some of these anatomical terms and positions. And we want to point out two things before we actually delve into the description of these terms. One, most of these are relative terms. So they're going to be used in respect of describing one structure in reference to another structure, okay? The second thing we want to understand here is that this is considering the body is in its full anatomical position. So the anatomical position, again, is an objective positioning of the body where the palms are in the same plane as the nose, which is in the same plane as the toes. So we're standing with palms slightly away from the body, palms facing forward, nose facing forward, and toes facing forward, as we can see in this description here. So this is full anatomical position, and this is how we envision the body positioned as we use these positional terms and anatomical descriptive terms. So the first set of terms are anterior, posterior, and this is basically front, back. So anything on the front of the body is anterior, anything on the back of the body is posterior. And again, taking into consideration that we can think of these as relative terms, I can say that the nose is anterior to the ears, but that the ears are also anterior to, let's say, the back of the skull. Okay, so again, these are going to be relative terms, one structure to another. We can also compare that to ventral dorsal, which is slightly similar, but ventral dorsal is more so describing a structure that protrudes from the body. So think about the tongue, which protrudes out forward, or the brain, which protrudes out forward. And so the ventral surface is going to be the surface that's anterior, and so that's going to be slightly facing downward. Or we can think about the tongue as well as an organ that protrudes. And then the dorsal surface is going to be on top, which we can think of it as being to the back, right? So ventral dorsal is similar to anterior posterior, but because this structure is protruding outward from the body, i.e. the brain or the tongue, we can think of the ventral surface as being underneath or anterior, and the dorsal surface as being on top or more posterior. The third set of terms here is superior, inferior. In simple, this is going to be top, bottom. Superior is going to be anything towards the top of the body or towards the head. And then inferior is going to be positioned inferiorly or below or towards the feet. Again, this can be relative. So while I can describe the thorax as being inferior to the head, I can also describe the lower extremities as being inferior to the thorax. Cranial caudal are, again, similar to superior, inferior, but this is really derived from describing an embryo. So we think about cranial and caudal when we look at an embryo, which is kind of folded. And so it's not standing upright the way the human body is in its fully developed form, but it's folded the way an embryo is. And so we describe the cranial structures as the structures that are towards the head of that embryo, and the caudal structures as the structures towards the tail or the feet of that embryo. So cranial caudal are going to be more specific to a structure that's not standing upright as the human body is in its developed form, but is kind of folded or lying or in its developmental stages. Proximal distal are terms that are relative to the midline or the middle of the body. So I can say that the hands are distal to the elbows, so it's going to be further away, whereas the shoulders are proximal to the elbow, so it's going to be closer towards the midline of the body. So again, when we're talking about two terms, we can think of their location to the midline of the body, and that's how we describe them as being proximal versus distal, or their location to each other as proximal versus distal. Medial and lateral, again, reference terms, but this is going to be kind of a horizontal description. So I can say that the upper extremities are going to be lateral to the umbilicus or to the thorax, whereas the thorax is going to be medial to the upper extremities. So horizontal positioning, again, as using the midline of the body as a reference point. So whatever is further away from the midline of the body in a horizontal sense is lateral, and whatever's closer to the midline of the body, again, in a horizontal sense, is medial. And we can also think of this in relation to one another. So once again, we're thinking about relative terms here. So if I'm looking at an artery and a vein, the structure that is closer to the midline is a medial structure, and the structure that's further away or more laterally placed is going to be the lateral structure. Deep and superficial are also two positional terms, but these are going to be in reference to the thickness. So we can think about superficial structures as closest to the surface, and deep structures as further away from the surface of that structure. So if we're looking at the human body in general, the skin is the most superficial structure, whereas the bone is going to be a deeper structure in reference to the skin. So we can say the skin is superficial to the bone, and the bone is deep to the skin, deep to the muscle, etc. And then right or left, this is probably the most simple set of terms. So right is going to be things that are on the right side of the body. Left is going to be things that are on the left side of the body. And we want to bear in mind here that this is having to do with the anatomical position, once again. So I'm not looking at my anatomical position, but I'm looking at the anatomical position of the structure, the model, the cadaver in question, or the image in question. So if I'm looking at this schematic illustration here, I can see that this woman is in anatomical position. Her left is actually my right, and her right is actually my left. So if I'm asked to point out her left clavicle, it's going to be the clavicle that's on my right. So I want to bear in mind that we're looking at the anatomical location of the structure, image, model, or cadaver, and not of my right or left. That's going to be really important in determining right or left structures. The next set of terms that we want to look at are called anatomical planes. So a plane is kind of an imaginary line that is aligning two structures. And so we've got several planes that can be used to divide the body and describe certain structures from that reference point as well. When we talk about planes, however, we're usually describing an image or a cross-section. So if I'm looking at a cross-section of the body, I'm imagining that there's a transverse plane that has divided that body into equal superior and inferior halves. And so I'm looking at that cross-section with that imaginary plane in mind. So there are also reference points to help us describe images and describe structures objectively as well. So the planes we have are the median or sagittal plane. And the median or sagittal plane are planes that divide the body into left and right halves. If we're talking about a median plane, it's going to be left and right equal halves. So it's going to be right down the middle of the body. If we're talking about sagittal, sometimes referred to as para-median planes, these are planes that are dividing the body into left and right halves, but they're not equal. So think about a plane that's going right down the shoulder, right down the clavicle, right down the upper extremity. They're also dividing the body into left and right, but only a median plane is going to be dividing the body into equal halves because it's going right down the middle of the body. And so that's going to be a median or a sagittal or paramedian plane. A parasagittal plane is going to be similar to a paramedian plane, again, not necessarily down the middle, but on either side of that midline plane. The next set of planes are frontal or coronal planes, and these divide the body into anterior and posterior parts. So again, thinking about a line that divides the body right through the ears or maybe right through the jawline, that's giving us an anterior portion and a posterior portion. That's what we describe as a frontal or coronal plane. And then finally, transverse, horizontal, or axial planes divide the body according to the middle. So it's going to give us a top and a bottom, or a superior and inferior parts. And these can be either equal, or they can be slightly obscured or oblong. And so we can describe those cross sections as being divided using a transverse, horizontal, or an axial plane.